Smoking during pregnancy is bad for you and your baby. It can cause serious health problems for both of you. Even if you don't smoke, being around secondhand smoke during pregnancy can harm your baby. Secondhand smoke is smoke from someone else's cigarette, cigar, or pipe. In this video, we talk about how you can quit smoking and stay away from secondhand smoke to help your baby be born healthy. Francesca, I just wanted to take a minute to talk to you about smoking during pregnancy. Now, smoking actually has a lot of health consequences for women throughout their lives. It can increase the risk of heart disease, stroke, it can increase the risk of cancer, gum disease, and just a variety of health conditions. So that's the compelling reason for women to quit smoking for their own health. But then when you're pregnant, of course, you have the additional concerns of your baby. And certainly smoking does cause harms to your baby. So for women who smoke, we like to think about what are the compelling reasons to quit. You can have risks during pregnancy. You can be at risk for bleeding. You can be at risk for placental problems. You can be at risk for preterm birth or low birth weight due to smoking. And so sometimes for women, understanding there's real medical consequences can be a real strong motivating factor during pregnancy. We know that babies born to moms who smoke can have increased risk of ear infections, asthma, and actually, sadly, increased risk of sudden infant death syndrome, which is death within the first year of life. Something to think about is what we'd call secondhand smoke. So the idea is not that you're smoking and the baby's getting the smoke directly, but that there's smoke in the home and then the baby's inhaling air that has smoke in it. And it used to be not sort of overlooked and not thought to be such a big deal. But actually there's lots of data looking at the health consequences for babies and children who are in homes where they're taking in a lot of secondhand smoke. And the data is pretty compelling that those children have consequences, specifically increased risk of ear infections, increased risk of asthma, and then unfortunately when they look at sudden infant death syndrome, it turns out that being in a home with smoke and inhaling secondhand smoke is a strong risk factor for sudden infant death. You know, smoking is really hard to quit because it's an addiction, and so we really try to emphasize for women that we know they're doing the best they can to take care of themselves and their baby. And certainly pregnancy is a time when you will undertake changes in your lifestyle, and getting ready for a new baby is often a time when you're highly motivated to change. What we really want to try to do is support women to quit smoking during pregnancy. So there are lots of things that we can offer moms, and first is to talk to their provider and try to get connected to local resources, like a counselor in the community, some support groups in the community or at the local hospital. Peer support groups can be helpful as well. There's also quit lines, and actually 1-800-QUIT-NOW is a quit line where women can call and get hooked up with a counselor, and the counselor can assist them with identifying their goals, setting goals, and then taking the steps to quit, actual practical steps to quitting. So it's never too late to quit, and whenever you can take the step to quit smoking, you're really making a tremendous health benefit for you and for your baby and for your whole family for that matter. Remember, smoking during pregnancy can cause serious health problems for you and your baby. If you're pregnant and smoking, quit now. It's not too late to help your baby be born healthy. Stay away from secondhand smoke. If you need help to quit smoking, visit smokefree.gov or call 1-800-QUIT-NOW. For more information, you can visit marchofdimes.com.